I'm Dr. Duran. I've been a medical doctor for 14 years. I have a diploma in dermatology, that is the study of skin, and I had acne as a teenager. Now, it was not that bad, but I developed very painful, sore, cystic acne later in life at about age 35. So I know how painful it is. I know the impact it has on your confidence. I know that it means you sometimes don't want to leave the house, and I know that it means that you sometimes don't even want to look people in the eye because you're so self-conscious. I also know how annoying and upsetting it is when people tell you to drink more water and stop touching your face. Let's get into it. There are 5 key drivers of acne. Number 1, Cutibacterium acnes. That's a bacteria that contributes to the development of acne. Number 2, increased sebum or oil production. Number 3, increased inflammation. Number 4, increased circulating androgens or testosterone, the male hormone, but women have it as well. And number 5 is hyperkeratinization. That's when the dead skin cell layer on top of our skin doesn't turn over as quickly and basically clogs our pores. Genetics can play a role as well, meaning that it runs in families. Some medications can cause it, for example, hormonal contraception or vitamin B12 injections can trigger acne for some people, and diet plays a role as well, particularly a high glycemic or a high sugar diet. Watch out for skim milk and whey protein supplements as well. They can exacerbate it and make it worse. I promise we'll dive into treatment options next, but you have to promise me that you won't forget these acne golden rules. Number 1 is acne takes time. Give it at least 6 to 8 weeks before you assess if a product is working for you or not. Number 2 is don't spot treat. You need to treat next month's acne today. Number 3 is don't over treat. A pea-sized amount of your product will do. Number 4 is don't forget to moisturize. Despite the increased sebum or oil production, your skin still needs to be moisturized. I admit I used to neglect moisturizer, and take it from me, it will make your acne worse. And number 5 is if an ingredient is causing irritation to your skin, you can use short contact therapy. That means putting it on the skin and washing it off after 15, 30, 60 minutes, whatever works best for you. Okay, first choose a cleanser. It might be all you need. I really like the Blemish Control Cleanser from CeraVe. It has salicylic acid. It exfoliates the dead skin cell layer on top of the skin that clogs the pores. It also has ceramides to support your skin barrier. Another salicylic acid cleanser that I like is the Sally Cleanse from Skin Ingredients. The other cleanser that you can look into is this one. It is panoxyl. It has benzoyl peroxide. That's an antimicrobial, so it can help with the bacterial element of acne. The salicylic acid smoothing cleanser from CeraVe is also worth checking out, and this is really good if you're dealing with any body acne. Next, moisturizers. Promise me you will continue to moisturize. My all-time favorite moisturizer for acne-prone skin is the Comedo Med moisturizer from Aven. There's also this one from Purified, and that has an added SPF as well, which is really handy. Before we dive a bit deeper and get into prescription options, there is this available over the counter. This is the CeraVe Blemish Control Gel. This is salicylic acid and alpha hydroxy acids that help with skin cell turnover. So if you're just starting out and you've mild acne and you haven't tried anything, this is a good one to start. One of the most effective ingredients for treating acne is benzoyl peroxide. This one, acne side, this has BPO. It's available over the counter. And then on prescription, there is this one. This is Duac, and this has a combination of benzoyl peroxide and clindamycin, a topical antibiotic. There's good evidence for blue and red light therapy as well. So when blue and red light are combined, it gives this purple color. So this combination can help to reduce the Cutibacterium acnes, and it can help reduce inflammation as well. Next up is retinoids. The gentlest one is adapalene, trade name Differin. That's available over the counter in the US, but here in Ireland a prescription is required. So if you're in the US, you could pick it up there. Another prescription option that includes adapalene is Epiduo. So that is a combination of benzoyl peroxide plus adapalene. Tretinoin is also a nice one. This is 0.025% tretinoin with added antibiotic clindamycin. And then of course there is good old-fashioned tretinoin. Next is azelaic acid. Now this is not as effective, but it's safe in pregnancy and breastfeeding. Over the counter there is this 10% option. This is from the Inky List, 10% azelaic acid. On prescription, there's a 15%, that's called Finacea, and there's also Skinorin 20% azelaic acid. Sulfur is an underrated but effective treatment for acne. This is the 10% sulfur acne treatment from Delacruz. Prescription oral options to ask your doctor about include doxycycline, that's an antibiotic, but it also has anti-inflammatory properties. There's also spironolactone, that can be helpful for women because it's an anti-androgen. It lowers the circulating androgens. It can be helpful for hormonal acne for women, especially women with PCOS. And of course, there's Roaccutane as well. Supplements that can help with acne include zinc and omega. You know what works best for you is trial and error. And I know that's exhausting and upsetting. I've been there. But you really do have to do the work to find out which product or combination of products works for your acne.